Hi, this is Dr. Nick Hayward. Welcome to COVID-19 Long Haul Stories. Today it's David's story. David, tell us a little bit about yourself and how you were before COVID-19 even came along.
Hi, my name's David D'Souza. I'm 37 years old. I'm a father of two. To be honest, Nick, I was a fairly active guy sort of before COVID. I used to play football twice a week. I was into my academics. I'm a second-year PhD student. And life was pretty normal beforehand, go out, come back in. And it's affected us all sort of similarly in terms of the lockdown. But unfortunately, COVID has sort of had a grip on us, or on me personally, for a bit longer than that.
Okay, wonderful. Thank you for sharing that. And it's important to note that in your case, you're someone of you're very young, very active, academically, very much involved, and family man. And that's kind of the demographic that often gets forgotten with COVID-19. We hear so much about those people who are perhaps much older and much more vulnerable to the disorder. But tell us about your journey. So what happened around the time of diagnosis for you, or when you first became unwell?
I first became unwell, I'd say, I know exactly the dates, was sort of the beginning of March. We sort of had a cold that swept through our house. Myself, my partner, my kids, we had like nasty coughs, temperatures and stuff like that, which lasted for about, I'd say, a week and a half. It stayed with me a little bit longer because at the time I was a smoker. So that's what I sort of put it down to at the time, that it's just hanging about a bit longer because of the cigarettes. Then that went away. Then obviously the lockdown sort of came in around the 23rd of March. And at that point, I was feeling better. I wouldn't say 100%, but almost there. Then I started noticing a lot of strange things sort of in April. So I suffered from like the second panic attack in my entire life for no particular reason. It just sort of came out of the blue one night while I was watching telly. My heart rate sort of picked up like there's a jump out of my chest. I was extremely short of breath, the cold sweats, the typical symptoms of a panic attack. And that's what I put it down to. I just thought, possibly the stress from lockdown or from work or something like that. And I forgot about it. Then 5 days later, the same thing happened, and it lasted for about an hour. And that's sort of what raised the concerns with me, that it was strange. I didn't feel particularly stressed. There was no triggers or anything like that. So I contacted my doctors. I informed them what had happened. They sort of immediately sort of put it down to stress, to say, maybe watch your diet, avoid stimulants like caffeine, maybe stop smoking and stuff like that. So I immediately put all that in place because I was quite nervous, to be honest. So I stopped smoking, I stopped drinking, I stopped caffeine, sugar, dairy, literally cold turkey. I stopped everything, and I thought I'd see how it went. Over the course of the following, I'd say, week or 2 weeks, the panic attacks became more frequent. I was having maybe 1 or 2 every single day. Some would be really quick, a couple of minutes. Some would last quite a while. And after the first week, I contacted the doctor again to say, this is still going on. Nothing's changed. I'm still feeling like this. If anything, they're getting worse. Again, it was put down to, just stress and stuff like that. So this pattern continued for about 3-4 weeks till I got a phone call from one of the doctors to say, this has gone on for a little while. Why don't you come in and do a blood test? It was a Thursday morning. I went and I did the blood test at about 8 o'clock in the morning. By lunchtime, they called me up to say, I need to get myself down to A&E because my D-dimer numbers were extremely high. And they were worried sort of about me possibly having a heart attack or something like that because of the chest pains that I was sort of suffering that week. I took myself down to the hospital. They did their tests there. They found that my D-dimer numbers were slightly high. They did an MRI, they did some x-rays, and they found that I had scarring on my right lung, I think it was, which was from an infection or something that they said had affected me. So I stayed in the hospital. I think it was over Thursday night. I left on Friday with a week's course of doxycycline, I think it was, which they gave me. They said that was the best antibiotic to sort of get rid of everything in my body. I took it for a week, and it was possibly one of the worst weeks I think I've ever had in my entire life. It didn't agree with me at all. I was constantly nauseous, extremely fatigued. I think over the course of that week, I think I lost close to 3 or 4 kilos or something like that, because I was just really unwell. And when I spoke to my doctors, they said, they understand what I'm going through. It's a very strong antibiotic. It's not unusual to have those sort of symptoms. I should just see it through. I took the doxy. I finished the course on that. And to be honest, I felt my chest did feel better, maybe like for about 2 or 3 days. The pain had gone away, but then after that, I had slight tightness. The panic attacks, thankfully, had stopped. They told me that I had to invest in oximeter, just in case when I having these palpitations, to check my saturation levels and stuff like that. Because when I had gone into the hospital, I think my saturation levels were sitting at about 88%, which they were slightly concerned about too. So those things went away, Nick. The panic attacks and stuff, they disappeared. But a week after finishing the course of doxycycline, these headaches sort of started to get a hold of me. So initially, I just thought, possibly I'm not drinking enough water, or it is stress because of the situation. So I addressed that. I started meditating. I started going for walks and stuff like that to just try and de-stress. Started drinking a whole lot of water and stuff like that. But the headaches they stayed with me. And this has now been going on. So since, I think beginning of June, I've had these headaches. I thought I'd see them out because maybe it was the antibiotics sort of making their way out of my system and stuff like that. So I gave it a month till I think beginning of July or middle of July. I phoned the doctors. I said to them, listen, I've got constant headaches. I've got brain fog. I feel dizzy. My vision is blurry sometimes. I just don't feel, I feel generally unwell. My doctor said to me that, that they thought it was classic symptoms of migraine. So they prescribed me amitriptyline in quite a low dosage, which I used to take one every night sort of before I went to bed. And initially it did help. For maybe the first week, I had a month's course. So I took it for the whole month. After the month, the headaches sort of intensified a little bit more. Found them back. They upped my dosage, which is now, I'm on 2 tablets every time before I go to bed. But like I've said to them, it's not helping. I still have these headaches. Things have changed slightly, that just randomly my ears will start ringing. The right side of my face goes numb sometimes. I get shooting pains sort of through my chest. My heart rate occasionally sort of picks up, or I'll just randomly wake up in the middle of the night and I get like this sensation that I've almost like passed out in my sleep. So I'll wake up and, I have a really racing heart, shortness of breath. It lasts a couple of minutes, but that is actually becoming sort of more common. That whereas it happened maybe once or twice over the course of a month, it's now maybe once every week that it's sort of happening.
I just want to interject there, David, because there's clearly a lot has happened in a very long space of time, actually. And just to summarize for those listening, it sounds like around the time of diagnosis, you were mildly, or around the time you became unwell, you were quite mildly affected with these cold-like symptoms. But then it was literally several weeks after that where you were noticing these strange panic attack type episodes, that when you went to hospital, you had elevations in your D dimer. And for those that don't know, this is an indication that your blood is not clotting correctly and that there might be little clots in your body for some reason. And there is evidence now to show that the coronavirus disease does actually cause this disruption to the clotting. So that's really suspicious. And indeed, we've seen these suspicious signs in your lungs. We've seen evidence of scarring on your lungs as well. We don't know when that happened exactly, but that's there. So at that time, just going back to that time where you were actually in hospital, did any clinician say this is coronavirus? What was their opinion at that time?
after the X-rays where they noticed the scarring on my lungs, the doctor that treated me at the time, she sort of took me aside and she said, what we can see on your lungs is sort of consistent with somebody that's had COVID. It's sort of like evidence that you've had COVID. And at the time, I was relieved because, feeling those symptoms, I sort of feared the worst. Being a smoker, I thought it was something completely different. And at the time, I was relieved to hear that it was COVID, as strange as that sounds. But yeah, so that's basically what was happening around that time.
So with that in mind, you actually at that time felt a sense of relief that it wasn't something more sinister. Was that because at the time, COVID-19 was very much something that kind of comes and goes in young people? Is that sort of how you were thinking?
Yes and no. I mean, at the time, like I said, because I was a smoker and because of the pains I was having in my chest, I feared something extremely more sinister than that. And when they explained to me that, they sort of said it was something that was consistent with having had COVID, I thought that I was basically over the worst of it. So that's where the sense of relief came through.
Okay, yeah, that really makes a lot of sense. And then now we're in the situation where you're describing these neurological issues, so concerns around your headaches, unusual nerve sensations in your face, describing an inability to concentrate at times, and you describe a brain fog. That again is something that we are starting to see in some patients who have had COVID-19. Just for the record, did anyone ever do a test? Because I know that access to testing has been really difficult for some.
Nobody's ever done a test. Do you mean like on an MRI for my head or a test for COVID?
Yeah, I mean, specifically for COVID-19, because at the time of diagnosis, as you say, in March time and early April, and even now, actually, it can be quite difficult to get access to testing. I was just wondering if anyone had sort of done that at the time, or maybe you just didn't quite qualify.
We went with my family and we did one of the government tests sort of at a position quite local. And when the tests came through, the tests came back negative for all of us. I think my partners was sort of inconclusive. They didn't really know. So, because we were all sort of that joint unit, we thought that if all three of us have come back negative, hers maybe was just a failing in how we've administered the test. But it's obviously negative too. So we did actually have an official test, but that came back negative.
And that was right at the beginning of things. And then obviously very much has changed since then, as you've described so well. Okay, well, I'm also a bit concerned. It sounds like clinicians have very many different opinions for you as to what's going on. How do you feel that the acknowledgement is around COVID-19 within the clinical community?
I feel it's a big elephant in the room that I don't think anyone wants to be brave enough to sort of be the one to put a label on it in terms of the people suffering from it long haul. I think a lot of the doctors, they choose to sort of address the smaller things that they think it could be, and they tend to dance around it, which is quite frustrating. It's extremely frustrating.
And how has that affected you personally? Because you mentioned that you're a PhD candidate, you're doing your PhD work, you're a family man. If no one can quite give you a diagnosis or a plan of how to get better from these long haul symptoms, I imagine that's causing some concerns. Are you willing to perhaps share some of that with us, please?
Yeah, I've been quite lucky in terms of my supervisor at my university has been extremely supportive. He's been fantastic. So I've managed to sort of delay things over there, and they've been supporting me at every step of the way. They've told me not to come back till I sort of feel 100%, which is a relief. At work, it's a bit tougher because, without an official diagnosis, the days that I don't feel well enough to go in, I still have to just sort of soldier it and come into work, which is, it's difficult, and I don't think it aids in my recovery at all, but it's something that I just have to do. But personally, I think in my personal relationships, it's a bit harder that, I think most people will support you when you've got an official diagnosis. But if your doctor is saying to you that, you're suffering from migraines, your partner or even your friends, if you're describing something a bit more sinister, they struggle to really grasp what you're going through. and empathize with you, really. So I'd say in my personal life, it's affected me worse than anything else.
Well, I'm genuinely sorry to hear that, David, and it's very challenging when one can't find the descriptions or the labels, if you like, which sometimes can be terrible in healthcare, but sometimes they are necessary when other people need to understand what's happening, whether that's in your employment circumstances or whether, as you say, in your personal life, others around you just need to understand. Tell me a little, if you don't mind, how the long-term symptoms have affected your family.
I think the fatigue that sort of sets in once in a while. There's days where literally I just want to be in bed. I don't want to leave the bed. So I'll maybe stay in bed maybe about 20 hours in a day. And, it does get frustrating for your partner because they have to deal with the kids themselves. They have to sort of deal with the house chores themselves. And I think that's where the frustration for them comes in, is they don't realize how you're actually feeling at that time, how bad you're actually feeling, because somebody's just sort of brushing it off as, migraines. So for my kids, I know it's been extremely frustrating because I used to be someone quite active with them. And, feeling the way I do, sort of with the headaches, the brain fog, the lack of concentration, I just don't feel confident in myself to sort of do a lot of tasks alone with them, just in case something happens to me. I mean, my youngest is 6 years old, so I'm quite nervous to be out with him by ourselves, just in case, something happens to me while I'm out with him. So in that regard, yeah, that's been possibly quite the toughest part on us, is, like I said, the personal side of things.
I really respect what you're saying, and there's no doubt that these concerns have a huge impact on everyone around you. And in this situation, you feel like you're not necessarily doing all the same dad activities that you have been before. Again, I'm very sorry to hear that. And I think it's often forgotten that there's an impact not just for you personally, but for the people around you. I just wanted to highlight that. Again, because you're a young guy in university, very active, family man, all of those considerations, there are lots of people like you that perhaps aren't really taking COVID-19 seriously. Do you have any messages for those people out there, or any other messages about your circumstances that you'd like to share with us?
For the people out there who aren't taking it seriously, I'd like them to really reconsider, because this thing is real. It doesn't seem like it's going away anytime soon. And I think the media has sort of let us down in explaining to people the long-term effects. You could be one of the many that are lucky to survive it, have mild symptoms, or even have no symptoms. But if you're one of the many unlucky ones that have the long-haul version of it, it's not fun. It's no joke. It's really tough. It is really a tough journey.
I think that's very important to mention. And I've said in this video series before that it's clear that everyone has a different response to this virus. And part of the reason why there's some uncertainty both in society and with clinicians is, of course, it is so new. And we have to respect that we are learning as we go. But at the same time, we do, as clinicians and members of society together, I really feel that we need to take this extremely seriously, because you're not the only one. And I can see that there are literally thousands, hundreds of thousands of people out there across the world who are having a long haul COVID. And as a consequence, that's having, as you've heard from you, huge impact on day-to-day activities, on families, on the economy. And I really think it's worth paying attention to that. I think you've shed a really big light on that consideration for someone who was previously so well. Any other thoughts for us today, David? Anything else you'd like us to be aware of?
For anybody that is suffering with symptoms sort of similar to this, there are groups out there that sort of offer support. Like I said, I was lucky enough to find one on Facebook, and it literally turned things around for me, because at the time I was not in a good place mentally. You begin to doubt yourself, when nobody can sort of empathize or confirm how you're feeling. You do begin to doubt yourself. And I was down. Lucky enough, I found a group, and just reading the stories of what other people are going through, it sort of puts everything into light that even though I feel I've had a tough time, there are some stories I've read that people have, had 10 times worse than I have. For some people, it's gone on for 7-8 months that they can't even leave their bed. I'm lucky enough that, I'm up and about. I don't feel like I'm back to normal yet, but I'm up and about and I'm dealing with it. But there are a lot of people who have it sort of much worse than I do. And, similar ages, similar stories. There's a person that I actually sort of have shared private messages with, and we just offer each other support, that he was younger than myself, possibly even more active than myself. And he's in a bad way. He can't leave his house, sort of hovers around his bed most of the day. But there is help out there. There are people that, can advise you on small little hints and tips that could help improve the quality of your life day to day.
I think it's wonderful that you've shared your experience with the community support that's out there. I think that those support networks are growing, and naturally, I'm just thrilled to hear that there are some people out there who really do understand and respect your situation and are there to offer support as well. David, I'd like to thank you most sincerely for this opportunity, for you to be so honest and so open with your experience. Most importantly, I'd like to wish you personally a very speedy recovery. I hope you get well soon, and without doubt, I hope, I wish the best to your family as well. I hope they can see the best of you again as soon as possible.
Thank you very much, Nick. It's much appreciated.